Functional diagnostic nutrition is a brand new concept for a lot of people. So to better explain what it is, how it works, why it's a different approach to health than what they may have experienced in the past through conventional medicine or conventional nutrition, I like to use this brain-body diagram designed by Dr. David Singer. Now, we all have a brain, and our brain's purpose is to communicate with the body. And the brain communicates with the body through a number of different ways, and we often talk about nerves, and another very common way is through hormones. And the purpose of this communication between the brain and the body is to provide a function. Now, when the brain is communicating with the body the way it's supposed to, the way it's designed to, and you have 100% function, this is what we call normal. Okay, now a person who is in this fully functional state is in a state of ease. And the medical term for this is homeostasis, or perfect balance. Now, the great thing about our bodies is that they're designed or evolved perfectly. We don't have to tell our cells how to be good cells. We don't have to tell our organs how to function. It just knows. But of course, this is not how people tend to come and see us at Perfect Health Project, or how they go and see the doctor. They tend to come with symptoms. So if you have 100% function and you're in a state of ease, how can you have symptoms? So what's happened at this point is you're now in a state of dis-ease, and you have a thing called malfunction, or you might say dysfunction. And this is what we call not normal. Now, you may have heard people say in the past, I'm putting on weight, but that's just my age, or I don't sleep as well, but that's normal for when you get older or you're stressed, or perhaps this one, I don't recover from a night out like I used to, but this is completely normal. If you understand nothing else, then understand this one thing. These things are not normal. If full function is normal and a state of ease is normal, these things, these symptoms are not normal. What they are is common. And common does not equal normal. It's very, very, very important to understand that. So you have a health complaint now, and that health complaint is evident because of the symptoms. And what you want is relief from those symptoms. And so let's say your symptom is insomnia. So you go to the doctor and you say, Doctor, I have insomnia. And he says, here's some relief. Here's a sleeping pill. Now, let's say you've heard that these sleeping pills can be dangerous and addictive and have side effects. So you're a little more conscious and you go to a nutritionist and you say, I have insomnia. And the nutritionist might say, well, here's some melatonin or some valerian root or something like that. Or let's say you can't afford a nutritionist, so you go to a vitamin shop and the store clerk recommends something. And this is also, you can get some relief from your symptom. Now, the difference between relief care, or otherwise known as allopathic care, and functional care is that functional care, functional nutrition, always asks why. Rather than saying, here's something for your symptom, we ask, why do you have a symptom? We're not saying, what disease do you have? We're asking, why do you have disease? Now, what can interfere with this communication from the brain to the body, and then of course lead to malfunction and dis-ease and symptoms, comes down to one very simple thing, and that is stress. Now, when you hear the word stress, generally people start to think of things like finances, relationships, their job, raising kids, all these kinds of things. And what these things are is one kind of stress that we call mental emotional stress. Now, that's the one that we all have, we all experience it. We're going to have it from the time we're born till the time we die. Some of us will have more than others, some of us will deal with it better than others. But at the end of the day, we all have this. But this is just one kind of stress. There are actually a couple of others. Second kind is biomechanical or physical stress. And that's when you've perhaps been in an accident, you have some kind of trauma, maybe a slipped disc or a fused spine, something along those lines. Also a very serious kind of stress that can break down that communication with the brain, between the brain and the body. And the third kind of stress is biochemical. And this is the kind of stress that we mostly focus on here at Perfect Health Project. And biochemical stresses can be anything from toxicities, deficiencies, malabsorption, malnutrition, hormonal imbalances, immune dysfunction, and even things like parasitic infestations, bacterial or fungal overgrowths, and the list goes on. So now these different stresses have broken down this communication from the brain to the body, and now you're left in a state of dis-ease and you have things going wrong, and so you head to the doctor or the nutritionist and you want relief. So the first type of relief care the doctor might give you is going to be drugs. Now, when drugs don't work after a while, they give you maybe stronger drugs, and eventually the ultimate form of relief care is surgery. When things eventually just stop working, they'll cut things out of you. Now watch what happens when we get this relief care. Symptoms go away. Do you think this person is now healthy? The answer is no, obviously, because they still have dysfunction or malfunction, and they're still in a state of dis-ease. And again, this is not normal. So what's going to happen then, if you have this dysfunction and this dis-ease that led to symptoms, is that the symptoms are eventually going to come back, and oftentimes worse than they were before. Now, corrective care works from the other end. Corrective care works at a subclinical level, meaning corrective care is not about treating and diagnosing disease. It's about asking why you have disease. Conventional care looks for disease. Functional care looks for dysfunction that led to the disease. Corrective care looks for healing opportunities. Again, not looking to diagnose disease, we're looking at what's dysfunctional in the body and how can we provide support to restore function and allow the body to act and function the way it wants to function. And thirdly, functional medicine always asks why. Again, we're not asking what disease do you have, we're asking why do you have disease. Now with corrective care, we start from the other end. So our main priority is to restore function first. And as we restore function to the body and the body begins to take care of itself the way it wants to, the body then returns to a state of ease or homeostasis. And because we're working non-specifically and not chasing disease, then symptoms will eventually just go away on their own because the body is operating the way it wants to operate. And again, we call this normal. So I hope now you have a better understanding of the difference between functional care and conventional care.